Hey there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Thanks so much for joining me on this video. I just wanted to shoot this video for you really quick before we start our day 2 of the Integrative Corrective Exercise Instructor Program. And this is really the introduction, the 3-day introduction into the integrative movement system. And I love the quote by James Clear, author of Atomic Habits. You don't rise to the level of your goals, you fall to the level of your systems. So if you want to create more sustainable changes with your clients to feel confident in working with the active aging population, especially those clients that have chronic tightness, discomfort, joint issues like osteoarthritis and or post-rehab or post-joint replacements, then you need a better system. And that's exactly what we teach during our 3-day introductory course to the integrative movement system. Today, in day 2, we're covering the hip complex and specifically looking at the link between the psoas and the glutes as part of the overall strategy for improving hip function, but specifically looking at the psoas and glutes and their role in creating stability, especially as our clients get into single leg stance. On Two Anatomy Geeks earlier in this week, we talked about the glute medius specifically. And Two Anatomy Geeks is a series that Jill and I do, and sometimes we have guest geeks jumping in to enjoy, or should say, to join into our session and contribute to our session. We talked about the functional anatomy of the glute medius and its function. Remember, the glute medius doesn't work in isolation, so we don't want to think about it that way specifically, but because there's so much talk about weak glute medius and what happens when clients stand in single leg, I just wanted to address. Recall that the glute medius is a muscle that attaches to the lateral iliac crest, and it also attaches down into the greater trochanter right here on the hip bone itself, the femur itself. The glute medius in isolation can do hip abduction, but as we discussed, not too many people are walking around life just kicking their leg out like this or doing tons of jumping jacks and things like that, unless you're a cheerleader or dancer or things, something like that. However, what the glute medius really does, or specifically does, is as you get into single leg, it helps to control the pelvis as you stand on that single leg stance. So it works with the entire glute complex, it works with the posterior oblique chain, it works with the lateral chain as well to create that stability as we get into single leg stance. What we tend to see in our older clients is one of two scenarios. And again, this is not just older clients, this is a lot of our clients, is they go into single leg stance and what happens is they over contract their glute med and they start to pull their body over top their foot. So they contract and laterally shift their center of mass over top their stance foot. So when your client walks, when they have this sort of strategy, you'll see them step and they'll go like this. They'll step, go like this. And you'll see that very commonly with clients that have chronic knee issues or back issues or foot issues. Because what the client is doing and what ultimately drives the knee into a valgus position is they're over-contracting the glute and they're driving the knee that way. Then they go to rehab, right? So they come to a rehab specialist or a chiropractor, physical therapist, massage therapist, and or personal trainer, and they get taught you have weak glute med and they do more abduction, which causes more contraction of that glute medius. So what we teach in our certification course, as well as all our programs, is rarely is single leg stability an issue of weakness. It's a strategy issue. And in order to change a strategy issue, you can't use strengthening exercises to change a strategy issue. For years and years, I tried to do tons of these lying hip abductions and clamshells and all these crazy exercises, and rarely did I ever see a functional change in how people were walking and how people were stabilizing on single leg stance until we change the strategy of how we work with our clients, and that's what I want to share with you here in this video. So the first part of the integrative movement system, corrective exercise strategy, is teaching our clients how to release through their hip, because so many of our clients have gripped their hips so tight that they can't even eccentrically load the hip complex, and that's really the key to improving glute medius function and single leg stability. So I'm going to show you real quick how to release the glute medius. We love the Rolga. The Rolga is our tool of choice and the official myofascial release tools of the integrative movement system. Again, we make no money for saying that. We just love this tool. We use every tool we recommend, we use on ourselves first, and then we use it with our patients in our clinic, and our patients loved it so much, almost all of them have bought Rolgas, and then we were just sold on the product. Like, it worked for us, worked for our patients, they love it, so almost all of them bought it. So again, check out Rolga, the guys and gals at Rolga, great product. Now the first thing we want to do is release. The reason why we like the Rolga so much are the grooves here. So again, we have a couple different zones here. We're going to put the TFL, the TFL on one of the raised levels here. we're going to put the IT band sort of in the center so we're not directly compressing down on the IT band, and this will go on the glute medius. So again, for the clients that especially overgrip this glute complex, this is a great way to release prior to teaching them the corrective exercise, the second part of the corrective exercise strategy. So simply what we do is, I'll go on my right side, I'm going to get down here, place my TFL on the front side of the raised hump area, and then put my TFL, I should say my glute medius, on the back side, and then as I roll through, I'm going to go real slow, allow myself to breathe, to lengthen. I want to create a nice long spine position, so I don't want my client all rolled up like this. I want to create that nice long spine position. If this is too much pressure for your client, have them just bring one leg off, keep a nice long spine, and then they'll just roll down to the next area, hold there, same idea. Stack the legs if your client needs more pressure. I'm going to lean forward just a little tiny bit to get a little bit more of the TFL release. And then keep pulling through. Go slow. If you find a spot, just hold and breathe. I'll go one more spot here. Just hold and breathe. Keep that length. Keep breathing into the cylinder, that thoracopelvic cylinder, as you do your release. You can also create a little bit of knee flexion there to get a little bit more length through the quad if you need it. But again, the goal here is just to release the lateral hip, the glute medius, TFL, where your client is gripping, so that way you can get into phase 2 of the integrative movements system corrective exercise strategy. Phase 2 is activation. So you've done your release, and the goal of the release is to release the areas of gripping and or restriction, so then you can, in phase 2, go into the activation phase, where you start to teach the individual how to use, more appropriately, use the glute as part of the overall strategy for improving stability. Our favorite go-to corrective exercise is the hip hinge, which goes right into our step out. So we've taught our client how to hip hinge first. Again, it's a long spine. We always start with that stacking and alignment of the thoracopelvic cylinder, hands upon the pelvis, and then it's just a hip hinge. Oftentimes, we'll start out with a supported hip hinge, which is a pattern we developed and we use with almost all our clients initially to teach the hip hinge pattern. So again, it's a nice long spine position. Stack that thoracopelvic cylinder, hands go upon the wall in front of the shoulders, and that's breathing in, breathing out, and hinging. So creating that anterior rotation of the entire cylinder, lengthening, widening the sit bones, lengthening the hamstrings and posterior glutes, coming back up to single legs, or coming up back up to standing tall, and then it's just a hinge, breathe out, breathe in, come back to standing. Breathe out, hinge, lengthen, making sure the client is getting that anterior rotation of the pelvis, anterior rotation of the entire cylinder over top their femoral heads. That leads into our next pattern, because you need to hinge in order to do the step out pattern, which is really one of our go-to patterns for pelvis and hip stability. So again, it starts with that nice long spine position, stack that thoracopelvic cylinder, hands on the pelvis, hinge first, and then a step out, maintaining alignment and control of that hip, knee, ankle, and foot complex. So that way the individual is using their glute complex, the glute medius, as part of the entire glute complex to stabilize the lower extremity. So from the side, same idea. So long spine, stack, hinge, step, maintaining that rotation up and over top of their femoral head. So again, they should feel it here in the glute, not in their knee, not in their low back. From the back, long spine, stack that thoracopelvic cylinder, hinge, step out, control the pelvis, control the lower extremity, so there's no change in the knee position. I'm not stepping to the side, I'm not leaning, I'm just maintaining that nice long spine, and a nice line here, and the logo on my back will show you that I'm keeping myself stable through this position. So again, you should feel it in the glute complex, teaching the glute medius to work as an overall part of the stability mechanism, that lateral chain, the oblique chain. So that way we're teaching the client how to integrate the glute medius into the overall function in single leg stability, and ultimately all the functional patterns your client needs to do. And that's important for using an assessment process to assess your client, to know where they need the release, and using a specific corrective exercise strategy to help improve your client's habits. You release, you activate, you use the right cues, that nice long spine position, creating that entire hip hinge of the, hinging of the entire cylinder, teaching your client how to own that position before you make it more challenging by going into single leg patterns, all your reaches, all your other more challenging patterns that come off the hip hinge, that come off a step out pattern. So this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education, coming to you live, day 2 of the Integrative Corrective Exercise Instructor Program. We've got another program in Boston, Mass in 4 weeks. So if you're looking for more information, if you truly want to master a systematic approach, learn how to assess, how to use the best and most effective corrective exercises, and how to integrate this information into the programs that you're already using with success, go to iihfe.com/certifications. And if you're looking just for more great information about training the older adult population, training clients with joint replacement, working with clients after surgery and or traumas, check out our website, iihfe. Sign up for our newsletter. We send out tons of free information. On Tuesdays, we have the 2 Anatomy Geeks. On the weekends, we send out one of these Facebook Live posts. We have tons of information on our Instagram page, so check that out too, at iihfe. And we look forward to seeing you soon. Make it a great Saturday. Talk soon.